Welcome to the Lifestyle MD podcast, the show dedicated to busy adults navigating family, career, and the challenges of midlife while striving for lasting wellness. I'm Dr. Angela, and I'm honored to be your guide on this journey. Hi, this is Dr. Angela. Welcome to another episode of the Lifestyle MD. Today, I am joined by Dr. John, who is a family medicine doctor. We are both DPC practice owners, and I'm so thrilled to have him here today to help me launch this short series about men's health. So, Dr. John, family medicine trained, DO, launched his practice, Thrive Family Health, in January of 2026. Welcome to the fold.
Thank you so much, Dr. Angela. I'm very excited to be here. It's a pleasure, as always, to work with you.
Yes. And we first met when you were in residency. And for the audience, he started his practice right out of residency. Talk about impressive, right? And he did a rotation with my practice and another practice in town. Was it just the two of us, Nova and my practice?
Well,
Okay. And you had already been considering direct primary care.
I found out about it when I was in medical school as a first year student, and I had one of the DPC doctors on the east side of the state. I think it was Dr. Paul Thomas. He just graduated residency that year, or a year before he came and spoke with us at the Family Medicine Interest Group, and he told us what DPC was. And I was like, huh, sounds interesting. And from then on, I just got more and more involved, and then in medical school, started doing rotations around DPC clinics such as yourself, and then into residency.
So excited to have you in this space. And one of the questions I have that I don't think I've ever asked you is, why did you choose family medicine?
The biggest thing is because I love working with everyone. So kiddos all the way to geriatrics. I like that continuity of care. I got inspired by my own doctor, who I've been seeing since 5 years old. He's still on the east side of the state, and every year I'm like, what's going on? Gotta retire so that way I can find another doctor. But it's relationships that are so deep, and that drove me into family medicine. In addition to the aspect of the holistic approach of you're caring for the whole person, not just one specific body organ. It's mental, body, spiritual, and family medicine. You do it all. So it's pretty cool.
That's a natural transition to why direct primary care was attractive to you, right?
Absolutely. It's getting deep with the relationships. So I wasn't
Nice.
able to do that in the traditional fee-for-service model.
So you were so willing to have this conversation with me. Tell me what draws you to men's health.
I think, especially being a man myself, I feel like there's so much that goes into, like, when I think of the word health, I'm not just thinking of like, how am I feeling? I'm thinking about like, how am I like thriving? What's my quality of life? On the younger side, feeling good and maintaining that, I look at some of my colleagues and friends or family who are older, because I've got friends of all different ages, and they have their different aches and pains and things like that. And what's going on, a lot of the time, they don't really seeking help before things arise.
It was important to me to have another clinician, but to have a male perspective on this so that I can talk to my clinical experience, but I can't talk from my personal and lived experience. And it's different. You embody a different experience and you see it and receive it a different kind of way. So
Ab-
you and I have seen similar patterns, right? That men delay care or don't seek care, or maybe they don't come to the doctor until someone tells them to because they're concerned about them or something major happens, right?
And it oftentimes, when you have that, it sometimes is going to be too late. So the biggest thing is, if things are starting to occur symptom wise, that's your body telling you, hey, something's wrong or needs to be addressed. But if you're being proactive with health and trying to optimize the six, I like to call them pillars of medicine, your diet, exercise, sleep, stress, social connections to friends, family, and avoidance of risky substances, if those are optimized,
Sound familiar, audience?
your body is naturally going to want to self-heal, because that's how we're designed to be made. The other analogy is you take care of your car, you get the oil changed and the tires
Yes.
rotated. So it's going to last you a while. So you don't have to buy a new one after 5 years. Your bodies are the same way. You've got to treat it well.
Exactly. I like using that analogy as well. I actually use it with all my patients, but it resonates with a lot of my male clients. You wouldn't let the tires on your car go until they fall off.
Mm.
So why do we treat our bodies with less attention at times when it is much more precious, right? Much more precious and much more valuable just in general. So this is a perfect segue. I want to talk specifically about why men delay care. Why do they wait until things become really severe? They often will normalize things like weight gain or poor sleep or stress. There's a very real cultural expectations around being really tough and resilient and having self-reliance. But on the flip side, I've also seen the opposite happening where men are being discouraged in some ways from even exhibiting that. So it depends on which kind of groups or where you are in society, who you're hanging out with as to which you're being fed, right?
Absolutely.
So why do you think men wait so long to seek care?
As men, we are naturally providers. We think of our family. We're the American culture is we're tough and we're able to do everything by
Mm,
ourselves, need any help. And if things are starting to kind of not feel well, you just push through because things are fine. But in reality, it's more of a immature response in our brain of thinking that we can just manage everything on our own when really we need to ask for help. We have to reach
mm.
out. It is a huge strength to reach out and ask for help when we need it because as humans in general, we're social creatures. We thrive when we're connecting into our communities and our loved ones. And we're all going through different struggles or problems that if we can share what's happening with our bodies with other people, you're going to get much more fruit when just being isolated and alone. Yeah.
I couldn't agree with that more. And one of the ways that we can encourage that is through encouraging men to connect with other men, right? And to be a part of that social connections piece. Because sometimes it may come from someone who's in your circle. And I think it's really important that we encourage men to do that. What are some of the symptoms that you think men are often dismissing that maybe they shouldn't be overlooking?
That's a great question. There's so many, but I think the common ones are weight gain. Okay, we're starting to get weight, kind of fatigue, or maybe low energy or decreased motivation. A lot of these things are attributed to, oh, I'm just getting older and
Mm,
normal. Let's hold the brakes a minute. These are subtle symptoms that your body's saying something's going wrong. And it's not going to just be black and white. Sometimes things might be black and white, but a lot of these changes are very subtle and accumulate over time very insidiously. A lot of those things are going to get missed. So, for example, the low energy question gets brushed off as, oh, it's because maybe I have low testosterone, or maybe
mm.
that's the biggest one.
A lot of men will just assume that my testosterone must be low, and it might be low, but
Yes.
there's more to it than that, right?
Yes. There's
Yes.
so much, especially when you think about your behavior, your mood, if you're chronically stressed, and these are things that are really going to saturate the energy out of you that you don't realize.
So when I have a patient, and I get the same questions from men and women, and it's interesting how similar that aspect can be. Oh, I'm really tired and run down, all these kind of things, and completely overlooking factors like maybe you're not fueling your body with the best nutrition on a regular basis. Maybe you're not moving. Maybe your sleep is either really too short or significantly interrupted, and your body doesn't have the capacity. And yeah, testosterone might be low, but is it low because you truly have a deficiency for age related reasons? Because let's be clear, men's testosterone naturally declines over time. But if
Mhm.
you're by on your 40s, let's go
Mhm.
look for root cause.
Yep. Absolutely. And when it's medically necessary, then obviously you treat it. But a lot of the times there's a lot more other factors that go into it. Component. We're so busy in our lives today that we're just like, okay, sleep's a last resort. We got to make sure we go to work, you come home, you eat dinner, you spend time, and then before you know it, it's like you're going to bed at midnight and then you got to wake up at
Hmm.
5 a.m. the next morning and
Do you still hear people say things like, I'll sleep when I die?
oh, absolutely. Sleeping's
Oh
for
my
the
gosh.
weak or things like that. It's no, your
Man,
body,
sleep.
there's so much that happens with sleep. Your brain's restoring memory, you're getting rid of all the just the toxins going through your body and just filtering things out. It allows you to really, again, there's just so many health benefits to sleep.
Yeah, and your immune system is
Mhm.
fortifying itself, and which is critical for fighting off cancer as well as disease.
Yeah,
So, really critical. I harp on sleep a lot. I think my patients are tired of hearing me talk about sleep. Speaking of sleep, if someone has a sleep partner, one of the things that they might hear is snoring. Snoring can be one of those factors that men are overlooking or dismissing. One of the first things that I hear, like when a man is coming to me because his partner brought something up, it usually might be, I'm snoring. What are some other things that partners and wives will bring up or notice before your patient does?
absolutely. So outside of specifically sleep apnea, which is a large percentage of the population, wives are going to notice with their husbands if they're, again, maybe not their own maybe behavior that they're not realizing. They might be more irritable, like the way that they're responding.
Mhm.
And that can again be accumulation of whether it's just chronic stress or if it's due to physical inactivity or again not connecting with your community, you start to become more irritable and lash out. Because again, life can be stressful. You have to make sure you're managing things well. And then I would say those are the biggest things for sure. The sleep and then the mood for sure.
The things that are going to probably directly impact someone else in the household.
Yes.
And then I would say another subtle one is the wife who says, my husband hasn't been to the doctor and I don't
Absolutely.
know how long. And I just need him to get checked up. I know he doesn't want to go, but I really just need him to come in. Right.
That's the biggest thing. You graduate at 18, you move away, go to school, and then you're in your 20s and 30s and nothing happens. And then before you know it, you're married, you're 45. It's like, oh, I haven't been to the doctor in almost 20 years.
Yes.
And then you get your basic checkup. And again, we don't find we're not searching for problems. We're just trying to figure out what's going on with your body. And so we
Yes.
get all the basic labs and workup, and then it's okay. Yep. Elevated blood pressure, high cholesterol, pre-diabetes. And so how do we work on optimizing those things so that way the rest of your organs, like your kidneys, your heart, aren't going to be getting stressed out with
Let
these.
they can do their job, right? This is something that I think is critical to reiterate. Looking for problems does not create the problems. It gives us the opportunity to address them before they become something bigger. I really like looking for even the insulin level. Someone might not be diabetic or pre diabetic yet, but they may be showing signs of insulin resistance. And you can pick up on those people just subjectively in our conversation, interacting with knowing their lifestyle. I don't want a normal A1C or a normal fasting blood sugar to deter someone from making critical changes that might prevent them in 5 years from actually flipping that switch.
Yes, absolutely. And a lot of these things that happen start early, and it's due to those habits that you're making when you're early on in your teenage years that go into your early 20s. Those habits then become
Mhm.
your lifestyle, and then the lifestyle
Right.
then changes into your health. It's a nice
Mm.
transition. I can't emphasize that enough. It's
And I
important.
feel like men, maybe more than women, are more likely to dismiss things and say, if I don't feel anything, I'm fine. I don't feel bad, so I must be okay. Would
Yes.
you agree?
I would completely agree that that is something that I see all the time because unless there's a problem that's right in their face, they don't register it as something to be addressed. But oftentimes, of course, there's a lot of things that are reversible, like we just mentioned, diabetes, cholesterol, blood pressure, we can get those down. But if you come in with a heart attack, that damage to the heart, that tissue is you can't recover that part of the heart.
Can't
So
get that back.
it's gone. Yeah, we don't want those things to happen. But again, a lot of those diabetes, cholesterol, blood pressure can lead to those heart attacks. So take action early, pay attention to subtle changes in your body, and be proactive and connecting with a family or internal medicine doctor or having that relationship with primary care so you can have a partner in your health because everyone needs it and it's something that person will thrive if that's
Ooh, Thrive. Nice plug for your practice name. I think that's a really good transition to move on to the next topic. Thank you so much for bringing those details together. And I hope that people will continue listening and hear what we have to say next. This has been another episode of The Lifestyle MD. Special thank you to Lou Musa for the show theme music, created with Free Photography, and makeup by Janae for the cover photo. And if you enjoyed this podcast and you haven't already, please subscribe today. And you may also follow me on Instagram at Angela Lifestyle MD. I am Dr. Angela. Thank you for joining me today.